Dr. Marie Winters is a licensed and board-certified naturopathic doctor specializing in integrative oncology and general naturopathic care in Philadelphia. As one of the city's first naturopathic doctors, she has nearly 2 decades of experience working in both private practice and hospital settings. Dr. Winters' medical degree is from Bastyr University, a leader in naturopathic medical education, and she is a fellow of the American Board of Naturopathic Oncology, FABNO, recognizing her specialized training in naturopathic oncology. Clinically, she worked in a hospital setting for 6 years, including serving as manager of the Naturopathic Medicine Department at Cancer Treatment Centers of America. Dr. Winters owns and operates her private practice, MyND Integrative Health, located in the Bach Building in Philadelphia. Her focus is on integrative oncology, helping people prevent cancer, navigate a cancer diagnosis, and build holistic survivorship plans. While specializing in hematologic malignancies or blood cancers, she also works with patients with solid tumors. In addition to oncology, she treats patients with a wide range of conditions, including autoimmune disease, chronic pain, allergies, asthma, and digestive issues. Dr. Winters develops individualized treatment plans that may include dietary and lifestyle recommendations, vitamins, herbs, and homeopathy. A common recommendation is diaphragmatic breathing to maintain and manage anxiety, and promote healing. She contributes to the education of future naturopathic doctors currently serving as adjunct faculty at the University of Western States, and as a past president of the Pennsylvania Association of Naturopathic Physicians. Dr. Winters was a key figure in the successful legislative effort to regulate naturopathic medicine in the state. She has presented her research on naturopathic and integrative oncology at national conferences, including the American Association of Naturopathic Physicians and the Society for Integrative Oncology. Please join me in welcoming Dr. Marie Winters to the 51st Annual Yoga Research Society Conference.
It's really an honor to be here today and speak with you. When I talked to Barbara asked me to speak about some very specific things: the history of naturopathic medicine, the guiding principles of naturopathic medicine, some case studies, examples of what I do on a day-to-day basis, and things that you all can incorporate into your day-to-day life. So that's my plan for today. There aren't many naturopathic doctors here in the city. I've been here for about 19 years. I've seen some naturopathic doctors come and go. Right now there are about 4 practicing NDs in the city of Philadelphia and about 4 out on the main line. So not a lot for a city of 1.5 million people. So you probably aren't familiar with me or my medicine or what I do. So first, Barbara asked me to tell you a little bit more about myself, and how I became a naturopathic doctor. I always knew I wanted to go into medicine for as long as I can remember, right up until the time where I got to my pre-medical program at the very large state school where I went, and it felt very impersonal and very cold, and it didn't feel very healthy at all. And I thought, wow, well, if this is medicine, I guess it's not what I want to do. So I went and I did a few other things. But I always wanted to get back to medicine. So what I did is I ended up going and working with a lay herbalist out in the Sonoran Desert in Arizona. And that was wonderful. Lillian Pax was her name. That's where I get my original medical herbal training from. And she was wonderful. She learned from her mother, who learned from her mother before her. She was from France. But I didn't really understand what was going on biologically with the herbs that I was recommending to the people who would come and see us. The science didn't connect with the herbalism. However, in the Sonoran Desert, there is a school of naturopathic medicine. Now they're called Sonoran University. Back then, they were Southwest College of Naturopathic Medicine. And many of the naturopathic students from that program would come, and they would learn from Lillian. And so that's how I learned about naturopathic medicine. And I found that, oh my goodness, here is a system of medicine that incorporates biology, chemistry, physiology, where I get to understand medicine, but I also get to practice natural holistic healing. And from there, I was certain that that's what I wanted to do. So I applied to and I enrolled at Bastyr University in Seattle. So I graduated in 2006. I've been here in Philadelphia since early 2007. At the time, Pennsylvania had no regulation for naturopathic medicine providers. And so since that time, since the mid-90s, they had been working to regulate naturopathic medicine in the state. I joined that effort at that time. And with exactly 10 years of work, we finally passed legislation to regulate naturopathic medicine in Pennsylvania in 2016. It took between 2016 to 2024 for the state to figure out how to take that legislation and turn it into actual regulations. And so starting in 2024, naturopathic doctors can now be registered in the state. We're the last state where that has become a possibility. So I'm very pleased and proud to have worked with that group of doctors so that consumers, when they look for a naturopathic doctor, can find one that's qualified. And we know that all of the things that we need to practice safely, we have done. So that's exciting. As you all heard, I do work primarily in integrative oncology care. I'm a fellow of the American Board of Integrative Oncology. I had my fellowship training at Cancer Treatment Centers of America in the Northeast when that was still here in Philadelphia. I worked there for about 6 years, and I've been in private practice ever since. I really love working in private practice because I would prefer not to see just people with a cancer diagnosis, although that is that is close to my heart. But I love seeing little kids in my practice. I love the person who comes in and has migraine headaches and IBS and things that are maybe a little bit less serious than a cancer diagnosis. I've worked with the American Board of Medical, the ABNO Board of Medical Examiners. I've worked with PANP, the AANP, and now I'm on the Oncology Association of Naturopathic Physicians Board. So I've done a lot of work with my field, and I'm really proud to be a naturopathic doctor. So, brief history, what is being a naturopathic doctor? As naturopathic doctors, just like modern medical doctors and osteopathic doctors, we really do trace our roots way back to Hippocrates. Hippocrates, of course, that school of thought was one of the first schools of thought to say, first, do no harm, and that is one of the tenets of naturopathic medicine. We see it a little bit different than medical doctors and osteopaths might, but we'll talk about that in a little bit. But also from the Hippocratic School of Medicine, from their vitalistic school of medicine, they had the concept of vis medicatrix naturae, or the healing power of nature. And so this is something that, again, we trace way back to Hippocrates. We believe that nature is naturally healing and the body naturally tries to heal itself. We want to get out of the way of the body's efforts to heal itself, and then we can see the most durable cure to illness. And of course, out of that vitalistic school, we also get the phrase, let foods be your medicines and medicines be your food. And if I can have people medicate themselves with the foods that they eat and help them in figuring out what foods work best for them, then if that can be your medicine, that is the easiest way, I believe, to medicate yourself, and one of the safest ways to medicate yourself. There were other doctors throughout history, throughout medieval times and throughout the Renaissance, like Maimonides and Paracelsus, that also had these vitalistic ideas about health. specifically Maimonides. He believed that diet, exercise, and your overall outlook were the key elements to health. Paracelsus, he took back that vitalistic school of thought, and he said that nature is the physician, not you. And so these are things that we as naturopathic doctors, again, keep close to our heart. Really, the father of modern naturopathic medicine is Sebastian Kneipp, who was around back in the 19th century. He was a priest from Bavaria who, while he was studying to become a priest, came down with a very bad case of tuberculosis, and he cured himself from tuberculosis using water and different water treatments. These were mostly very, very harsh cold water treatments. He then, once he became a priest and survived and was cured of tuberculosis, went on to use this type of water cure with his parishioners. And then people started coming to him from all over Germany, all over Europe, and pretty soon from all over the world. At one point, he was considered the third most famous person in the world behind the US president and the German chancellor. So he was very, very well known. And not only did he incorporate water cure, but his mother was also a lay herbalist, and so he used herbal medicine in conjunction with water cure. He felt that everything in nature was something that was given by God in order that it could heal us as human beings. And he learned over time that the treatments that he gave himself when he was recovering from tuberculosis were very, very harsh. And so he felt that medicine, over time, he learned that medicine should be gentle and medicine should be individualized. And it was said that no two prescriptions of his were exactly the same. And that is certainly something we carry into modern-day naturopathic medicine. Then we have Benedict Lust. Benedict Lust was born in Germany. He emigrated to the United States, and he too came down with a very bad case of tuberculosis. He went to Germany, and he was cured of tuberculosis by Sebastian Kneipp. And then he got Kneipp's permission to bring that water cure back to the United States. Here in the United States, he also added ideas, nutrition, massage, electrotherapy, physical manipulation, exercise, and put all of these things together with water cure, and that really is the birth of naturopathy or naturopathic medicine. So that really is where it comes from. Lust was a very enterprising man. He founded a sanatorium based on Kneipp's teachings. He founded a school of naturopathic medicine that was called the American School of Naturopathy in 1902 in Manhattan. He launched a magazine, he opened a store, and suddenly naturopathic medicine was off and running, and schools started popping up. We started graduating naturopathic doctors from these schools. It gained quite a bit of popularity here in the United States, and that really is the heart of naturopathic medicine, or modern naturopathic medicine. However, from an early time, I should say the last bullet point on there is that Lust was arrested 16 times for practicing medicine without a license. And so naturopathic medicine didn't fit in with the idea of medicine as we knew it here in the United States. And so Lust in many ways was an outlaw, despite the fact that he was helping people to get better. This is a quote from Lust: "The prosecution became so intense that we could not use the word cure, healing, therapy, therapist, physician, doctor, or any other similar title. And so what they landed on was naturopath, which puts the word nature and pathology together. In many ways, it's a misnomer because it's not the pathology of nature. It's just that nature heals pathology. But at any rate, they were able to use the word naturopathy and not medicine and not doctor, and that allowed them to elude the New York Medical Society and the American Medical Association. So that's where the term naturopathy comes from. Naturopathy, like I said, was up and running and kept going and growing up until the Flexner Report. So the Flexner Report was commissioned by the Council on Medical Education, and it was published by the Carnegie Foundation. It looked at how medical education here in the United States wasn't standardized. And without standards, they said that we're graduating lots of doctors that are probably not very good doctors. So what they really wanted to do is standardize medical education, which, to be quite honest, I think that we do need standards in medical education, whether it's naturopathic medical education, medical doctors, osteopathic doctors, etc. Consumers need to know that the person they're going to has been well educated. But at the same time, the Flexner report was very, very scathing, and it was very scary to medical schools. When the Flexner report was published, there were 160 medical schools here in the United States. After the Flexner report was published, that number dropped down to about 66 medical schools. It aligned all natural medicine training with quackery, essentially. And so most of the schools of naturopathic medicine were forced to shut down. Unfortunately, most of the schools that educated black doctors here in the United States were forced to shut down. There were only 2 after the Flexner report. And most of the medical schools that educated women doctors were also forced to shut down. There was only 1 in existence after the Flexner report, which was actually here in Philadelphia. And so many of the naturopathic medical schools were forced to close after Flexner. John Bastyr, which is the namesake of the school where I went, he was one of the links between those original naturopathic doctors and modern naturopathic doctors today. He blended traditional naturopathic medicine, traditional water cure, with botanical medicine and modern diagnostic methods. His mother was a follower of Knipe, and his mother was also a lay herbalist. He studied chiropractic medicine and homeopathy and obstetrics and worked at Grace Hospital in Seattle. Dr. Bastyr was part of the founding group of the school in Portland that is now the National University of Naturopathic Medicine. So that's the oldest school of naturopathic medicine here in the United States. And his students went on to found Bastyr University in Seattle, which is where I went. And so really my training goes back to Dr. Bastyr, who goes back to Dr. Knipe. And it's always nice to see that that evolution of medicine and know that what I've learned goes back to those earlier teachings. One of the things that Dr. Bastyr felt very, very strongly about is that the patient is the healer. And so he said the patient is the one who's doing the healing. It's not me. I'm not curing the patient. The patient is healing themselves. So today there are about 9 different universities of naturopathic medicine here and in Canada. As I said, I went to Bastyr University. Most of these are out on the West Coast. The National University of Naturopathic Medicine is outside of Chicago. And the National University, the Canadian College of Naturopathic Medicine is in Toronto. The Universidad Ana Mendez is in Puerto Rico, but everything else is out on the West Coast, which is unfortunate. And so to become a naturopathic doctor, it is a 4 to 5 year graduate level training curriculum. There's 4,100 required hours of didactic and clinical education. There's 2 years of training in biomedical sciences and 2 to 3 years of clinical hands-on training. We learn clinical nutrition, physical medicine, botanical medicine, homeopathic medicine, psychology, and counseling in our standardized medical curriculum. And then, of course, we need to pass our board exams, which are known as the Naturopathic Physician Licensing Board Exams, or the NCLEX. Today, there are 23 states, plus Washington, D.C., Puerto Rico, and the U.S. Virgin Islands that govern the practice of naturopathic medicine. 6 of the Canadian provinces and 1 territory also regulate naturopathic doctors. And as I mentioned before, Pennsylvania was the most recent state to begin regulating naturopathic doctors. There are about 15 of us that have become registered in the state of Pennsylvania to date. Because it's the first time around, it takes a really long time. So, but hopefully that process will speed up as more of us go through it for the first time. Right now, the American Association of Naturopathic Physicians estimates there are about 6,000 of us in the United States. There are many different specialty associations of naturopathic medicine. I belong to the Oncology Association of Naturopathic Medicine, but certainly if you're looking for a specific practice, you can go to those association websites and find specialists, maybe not near you because there aren't that many of us here in Pennsylvania just yet, but hopefully maybe someone who can work with you virtually. The American Association of Naturopathic Physicians is our national association, and the Pennsylvania Association of Naturopathic Physicians is our state organization. Whew. All right, so that's the history and what naturopathic medicine kind of is at its foundation. I do also want to say that because this is a small group, if you have a burning question, do feel free to raise your hand. I will have time for questions afterward, but if you need to know something right now, I can try to answer it for you right now. All right, so let's talk a little bit. Oh, yes.
Just wanted to know the main difference between ND, the naturopathic doctor, and NP, practitioner.
Well, an NP is usually a nurse practitioner, not a naturopathic practitioner. Yeah, I mean, if someone calls themselves an NP, but they use N for naturopath, that probably means that they didn't go through the required educational training that you need to be called an ND. Most NPs are nurse practitioners that I know of, but if they say naturopathic practitioner, that probably means that they can't legally call themselves a naturopathic doctor. Yeah. Okay. All right, so let's talk a little bit about some of the guiding principles of naturopathic medicine. And so, at its core definition, naturopathic medicine is a distinct system of primary health care that emphasizes prevention and the self-healing process through the use of natural therapies. Naturopathic doctors are primary care physicians who blend centuries-old knowledge and a philosophy that nature is the most effective healer with current research on health and human systems. Now, I do want to put a little asterisk here, because here in Pennsylvania, they say that no, you are certainly trained up to the level of primary care provider, but I'm not, as a registered provider here in the state, considered a primary care provider. So while I could, I don't. So I can't be your primary care physician here in Pennsylvania, but I certainly could in other states. So if I were over the border one way or the other, maybe, but not right here, right now. So naturopathic diagnosis focuses on identifying underlying causes of disease, while naturopathic therapies are supported by research drawn from peer-reviewed journals from many disciplines, including naturopathic medicine, conventional medicine, European complementary medicine, clinical nutrition, phytotherapy, pharmacognosy, homeopathy, psychology, and spirituality. So I have a very, very, very large toolbox to draw from, and that's often what I tell my patients. Usually if you go into your conventional primary care doctor, you're not feeling well, they're going to give you a prescription medication and tell you to take this much for this amount of time, and you're going to get better. If someone comes in to see me, I start to think, what are the different things that I can gather for this particular person? What is deficient in their lifestyle? What are they not eating? What are they eating too much of? Are they sleeping through the night? What kinds of natural therapies can we use, not just to reduce their symptoms, but to stimulate the healing processes of their body so their body can bring themselves back into balance in a better way? And very often, I'm working in conjunction with their medical team. So they have a primary care doctor who might say, okay, you need to do this, this, this. And then I say, oh, but how can we make this picture more whole? How can we take everything that we have to offer in nature and really help their healing be more profound? Every once in a while, a primary care doctor will say, oh, that all sounds great. They usually think either what I'm saying is completely ineffective or it's very scary and dangerous and is likely to hurt them irreparably. And so, or they think both of those things at the same time. Not to generalize, but that happens very often. And so they might say, oh, this, and this are fine, but you can't use this thing. That is very dangerous. And honestly, I'm fine with that because I have such a big toolbox to choose from. I can find a different medicine, I can find a different herb, I can find a different way to do exactly what I was trying to do with that one thing that they said I can't use. So, as I mentioned, I might recommend lifestyle interventions, nutritional recommendations, vitamins, minerals, botanical medicines, food-based supplements, homeopathy, physical medicine, and if I were in another state where I had prescriptive rights, I might use pharmaceutical medications when appropriate. So that's pretty much the totality of my toolbox. Yes, oh, and I think someone needs to come see you with the microphone.
Doctors in Pennsylvania don't have prescriptive pharmaceutical rights, is that right?
Naturopathic doctors, we don't, no.
Okay. What state that touches Pennsylvania does have that?
That's a really good question, and I don't know all the regulations state by state. Maryland is also regulated, and then Washington, D.C. is also regulated. I know there are prescriptive rights in D.C. I don't know about Maryland. The states that have the widest scope here on the East Coast are Vermont and New Hampshire. Vermont by far. Vermont has the entire medical formulary is open to you as a naturopathic doctor.
Okay, thank you.
So naturopathic medical visits in some ways can be very similar to a medical visit. I mean, you might see all of these things and think that that sounds like I'm going to see the doctor, except that this is a really thorough intake. And this is because as naturopathic doctors, our goal is to treat the whole person and to treat the body holistically. So while taking a history of present illness, while taking a medical history, while doing a review of systems, might all sound like, oh yeah, that's just what doctors do. Most doctors that you go to see these days, they'll do an abbreviated version of all of these things probably in about 7 to 9 minutes. A naturopathic physician's my first intake, I schedule for, well, it's on the schedule for an hour and a half in case I go over, but an hour and 15 is where I imagine I'm going to be collecting this information. And so it is a very, very wide-ranging intake because I need to get to know you as an individual. I see people every day that have a cancer diagnosis. I must see, well over 100 patients that have breast cancer, but every single one of those patients is different from the next. I could have 20 women in my office that have all had a breast cancer diagnosis. They're different ages, they have different medical histories, they have different pathology of their cancer, they've had different treatments, they have different food sensitivities, different exercise levels. They have all of these things make those people an individual. And so if I'm going to put together a treatment plan that's going to work for them, I need to know them. I can't tell every single one of my patients to go get on a treadmill and do 150 minutes walking on a treadmill every week. Half of them don't like that at all. Half of them can't do that. Half of them are going to be like, I already exercise 150 minutes a week. Why are you telling me to do this? You clearly don't know me. And so I really need to get to know these people. And that's at the heart of naturopathic medicine too. You're getting to know the individual, and you're taking what you know based on evidence, your clinical evidence and the best medical evidence that we have to date, and you're applying it to that person. And so you can't do that with a 6-minute visit. You can't do that with a 12-minute visit. And that's one of the main differences between naturopathic and conventional medicine. It's the same Western idea of medicine. It's the same pathology, same biology. The difference is that I'm seeing you and seeing your body and trying to figure out how to get your body to work better, and doing that in conjunction with you. So as naturopathic doctors, we honor what we consider the therapeutic order. The therapeutic order shows that you need to have a good foundation in order to support overall health. And so you can start working with the patient anywhere on this therapeutic order, but wherever you start working from, you always need to work below as well. So a person can't be healthy unless they've established foundations for optimal health. They can't be healthy unless they're eating a diet that is healthy for them. They can't be healthy unless they're able to sleep. They can't be healthy unless they're breathing, unless their nervous system is settled. And so no matter where we're seeing a person on the therapeutic order, I'm always thinking about making sure that we've established those foundations for health. And then from there, we can think about, once they have those foundations in place, we can stimulate the body's self-healing mechanism. So we can stimulate that vital energy that allows our tissue to knit back together if we have a scrape on the surface of our hand. That allows, if we have a sore in our mouth, that skin to heal back up. That allows that if we get sick with a cold virus, we're going to get over it. We can't stimulate that vital force until we have the foundation for health. And we can't support weakened systems without the body's own ability to heal. And so we are always thinking about the therapeutic order when we're thinking about how a person gets better. Now, I'll be talking about a case in just a moment where I start with the highest level, where they came to see me because they were looking to support weakened systems and stimulate self-healing, but they needed much, much more than that. So we can start here at any spot, but we have to fill in that whole triangle in order to have full health. And ideally, naturopathic doctors, while we are very concerned with diagnosis, and very often patients are very concerned with diagnosis, and it's interesting to see how that's changed over time. Back when I was younger, so many people would say, oh, I don't want that diagnosis, don't put me in a box, I am an individual. And these days I feel like it's turned and done a whole 180, and everyone wants lots of diagnoses so that they can really understand themselves and their pathology. I'm diagnosis neutral, to be quite honest. So first of all, I should say they don't want me diagnosing anyone in Pennsylvania, but I could if I were in another state. But very often the diagnosis isn't as important to me because I need to understand what is the root cause of this diagnosis. I need to understand if we're seeing this manifestation of disease because there's an imbalance in the microbiome, or if there's systemic inflammation in the body, or if you have a chronic mold exposure and so your entire body is weakened. And so I really need to understand the root cause of what's going on more than I need to understand that you have these 5 symptoms, but not these 2, and so then you fit into this diagnosis box. I need to understand why it's happening. And so that's one of the things that I'm always striving to figure out in that hour and 15 minute initial visit and subsequent visits from there. So there are 6 guiding principles of naturopathic medicine, and this is really where I'm going to spend the bulk of my time speaking. The 6 principles are: first, do no harm, as I mentioned, and then honor the healing power of nature, or the vis medicatrix naturae, which goes again back to Hippocrates. And then we want to identify and treat the cause of disease. We want to make sure we're treating the whole person and not just one specific symptom. We want to prevent disease whenever possible. And then, of course, the last thing I'm going to talk about is the physician as teacher, or this idea of docere, which is the root of where the word doctor comes from. So first of all, we have primum non nocere, first do no harm. And so as naturopathic doctors, one of the things that this means is that you want to use the least force necessary to diagnose and to treat illness. You don't want to hurt a person with your treatment. And as naturopathic doctors, we're using natural interventions that very rarely have any side effects associated with them. And so we want to make sure that we're doing that as much as possible. We want to choose interventions with the least likelihood of side effects, like diet and lifestyle changes, and we want to avoid suppressing a person's symptoms. In naturopathic medicine, if we're suppressing a symptom instead of treating the underlying cause, our thinking goes that this can interfere with the body's healing process. And so we need to allow the body to do what it wants to do in order for the body to work, the body's organ systems to work together harmoniously. But also, first do no harm means understanding when it's appropriate to refer. And so I'm going to go over a case for each of these guiding principles. And the case that came to mind when I was thinking about primum non nocere is a very recent case that I just had. And it might be a little bit different than what a lot of you are thinking when it comes to this guiding principle. So KS was a 36-year-old landscaper. He had a 6-month history of low back pain that progressively got worse to where he ended up in the emergency room. In the emergency room, he was diagnosed with a large mass in his colon, and they also saw 3 very large masses in his liver, and it eventually led to a diagnosis of stage 4 colon cancer. KS went online, and these days it's very, very easy to go online and find whatever information you're looking for. In his heart, KS did not want conventional treatment, and so it was very easy for this person to find many different places online that told him that chemotherapy was going to kill him. You didn't want to treat this with cutting, slashing, burning. You wanted to treat this with a carnivore diet, with avoiding seed oils, with, weightlifting, with a whole host of things. And so he adopted a mostly meat diet. He was frying things in tallow. He was doing a lot of things, and I laughed just for lack of not wanting to cry. And then he reached out to me, and he said he was looking for someone. I specialize in integrative oncology, and he was like, I'm doing all of these things. I want you to help me so I can treat this naturally. And these are all of the things that I'm doing. What else can I do besides this? You can't effectively treat stage 4 cancer with natural therapies. You just can't. And if you could, I would be the first person to say that. I went to school for naturopathic medicine. If I could treat this with a whole host of herbs and diet, I certainly would. And there are some early stage prostate cancers or early stage lymphomas where you don't need conventional treatment. And I am here to say, here, let's do all of these things that I know how to do to push back, to go as long as you can go without conventional treatment and maybe avoid it altogether. In this case, you're not going to do that, and you're definitely not going to do that with the carnivore diet. And so for this individual, we had 2 very long conversations, and this was before he even signed on as a patient, but it was a matter of listening to him, understanding where he came from, and being able to talk with him, talk about the natural history of colon cancer, talk to him about his concerns, talk to him about naturopathic supportive care and what I can do to support him through treatment, understand his beliefs, talk about my beliefs, give him ideas for referrals for different hospital systems here in the area, and try to get him in to see someone. I mean, they were tearful conversations on his part, and he is a very, tough 36-year-old, blue-collar worker. He cried for me probably, and not for the rest of his family. And ultimately, he agreed to chemotherapy, FOLFOX chemotherapy, which is the standard of care. And he came in to see me, and we talked about what we can do to help with the course of his disease. We talked about cardiovascular exercise. He was lifting weights, which are great. There's nothing wrong with weights. But with cardiovascular exercise, you can potentially help improve disease outcome and improve disease-free and overall survival. We talked about overhauling his nutrition overall. Fiber is so important after a colon cancer diagnosis. And so moving him from the carnivore diet and beef tallow to a diet where he's eating a basis of fruits and vegetables on a daily basis, going from saturated fat, which is going to enhance inflammation and shorten his life based on prospective studies, to a diet that has lots of omega-3s and monounsaturated fats. So we overhauled his diet completely. And then I made some recommendations to help to minimize side effects of treatment and ideally to help augment his treatment. So hopefully it would work even better than without the supplements themselves. And so KS has completed 6 cycles of his FOLFOX chemotherapy. He honestly had minimal side effects. He had 1 cycle where he had really bad nausea. So we talked about things to help with that, and he got through the next 2 cycles really, really well. He only got up to about a grade 1 peripheral neuropathy. That's numbness and tingling in your fingers and toes. That was after his last cycle, but then he had 3 weeks off, and it essentially went away completely. And he did have a dramatic response to treatment. He had over a 50% decrease in each of the 3 liver lesions, and that original lesion in his colon was no longer detectable on CT scan, which meant that he is now a candidate for surgery, which he was not going to be before. And so this is primum non nocere. I don't want to hurt my patient with supporting his misguided ideas. I also don't want to hurt my patient by dismissing where he's coming from. You need that relationship and to build that trust and understanding so that he can live a long life. And then naturopathically, I can support him through conventional care to make sure he gets through it very well. And so that's KS. He'll have surgery later this month, a couple of weeks. All right. The next principle is, I've mentioned it a couple of times before, the vis medicatrix naturae, or supporting the healing power of nature. A lot of times when people hear this, they understand this to mean that natural products can help to heal the body, which is true. I do think natural products can help heal the body. But really what this means is that the body has the inherent ability to heal itself, and you just need to get out of the body's way to let the body do what it needs to do. One of the ways of getting out of the way here is that removing what we call obstacles to cure so that the body can reestablish a state of health. And as naturopathic doctors, we establish a healing environment using low-level interventions to help to support what the body needs and ultimately wants to do. So the case study to demonstrate vis medicatrix naturae is BA. She may be 29 now. But at any rate, she was a 27-year-old respiratory therapist. She had a 4-year history of asthma, and she had repeated respiratory tract infections. And when I say repeated respiratory tract infections, she had 3 cases of bronchitis minimum each year for the last 4 years. She'd been on multiple rounds of antibiotics, and again, we're talking 3 or 4 rounds at least every year for the last 3 years. She had been prescribed prednisone. I didn't believe it when I looked at my notes, but then I went back and counted through them, and yes, almost 30 times she'd been prescribed a course of prednisone over 4 years. In that time span, she'd had her tonsils removed because of recurrent strep throat. She tried every different over-the-counter allergy medicine you could think of. She had multiple different inhalers for asthma and for chronic bronchitis. And really, she had no long-term symptom resolution. She would go right back into another cycle, into another cycle, into another cycle. The steroids that she was on often led to thrush, which is a fungal overgrowth in the back of her throat. And here she was, a healthy 27-year-old with multiple cases of thrush over 4 years. She also complained of chronic GI upset, and she was unable to sleep through the night. She woke 3 to 4 times every night. So again, I do that long intake. And so on further questioning, we found that her symptoms began in her last year of undergraduate school. That year, she was forced to find different housing due to the discovery of a leak and extensive mold in her apartment. She was also dealing with a very hostile work environment at the time. She was exposed to racist comments by 2 specific coworkers in her department, and that was chronic stress that she was exposed to on a daily basis. So we did some functional medicine testing that revealed what we call mycotoxicity. She had elevated levels of ochratoxin, gliotoxin, and mycophenolic acid, and she also had what we call an inverted cortisol rhythm. Mycotoxicity is something that we find after chronic exposure to fungi and molds, and this can be consumption, like oral consumption, inhalation, or skin-to-skin contact. Mold metabolites can cause both acute and chronic symptoms. This can include digestive symptoms, this can include neurologic symptoms, this can include immune system impairment, this could include cognitive changes, and so we discovered that she definitely, probably due to that mold exposure 4 years ago, had chronic mycotoxicity. And then cortisol rhythm. This is an inverted cortisol rhythm is something that we see after chronic stress. And when we think of stress, we think, oh my goodness, I have to pay these bills. But stress can be physical stress. Stress can be the stress of mycotoxicity. Stress can also be the stress she was facing in the workplace. If you have a healthy cortisol rhythm, in the morning, after you wake, your adrenal glands make lots of cortisol that gives us great grounded vital energy to start the day. That carries us through the day, and towards the end of the day, cortisol levels naturally drop off, melatonin levels rise, and we sleep soundly through the night. With chronic stress, what we can see sometimes is an inverted cortisol rhythm, where our cortisol is actually low through the morning, and it starts to pick up through the afternoon, and it can peak overnight. And oftentimes, these people are people who are dragging themselves through the day, and then suddenly they're like, oh, I'm kind of perking up around 8 o'clock, 9 o'clock, and then they can't get a good night's sleep. They're waking up in the middle of the night, often with their heart pounding, often with their mind racing. And so that's essentially what this patient had been happening with this patient. So for mycotoxicity, we wanted to make sure that mold hadn't made a home, or the fungus hadn't made a home in her body. Considering it was 4 years later, we assumed that it had. And so I used a nasal spray with grapeseed extract because she had mostly been inhaling these mycotoxins, and most of the symptomatology was in her respiratory tract. I used natural systemic antifungals to help with, and I used supplements to support her natural detoxification process to move those mycotoxins out of her system. For that inverted cortisol rhythm, I used different adaptogens, and these days if you go on TikTok, everything is an adaptogen. This clicker is probably an adaptogen. But actual adaptogens extend the half-life of cortisol. And so I used different adaptogens, ones that would wake the body up in the morning and remind the adrenal glands that it was supposed to be making cortisol, and ones that are going to help suppress cortisol production in the evening to rebalance that cortisol rhythm. And by doing that over a period of several months, the body takes over and does what you're suggesting that it's supposed to do. And then also through some questioning, we found that she really wasn't tolerating dairy very well. And dairy is one of the things that if you don't tolerate it very well, it can very often cause a lot of respiratory symptoms, a lot of congestion, especially upper respiratory congestion. So we recommended that she take the dairy out of her diet. And we added some botanicals to help soothe the digestive tract and a probiotic to help replenish the microbiome. So overall, the naturopathic treatment lasted about 5 months. The patient had her first winter in 4 years without a bronchitis diagnosis. At this point, it's been about an entire year without a diagnosis of bronchitis, without the need for antibiotics, and without the need for steroids. This was accomplished just by removing obstacles to cure. So we removed the mycotoxins. She did eventually remove the stress. I did recommend she go to counseling, and eventually she found another job and a much more supportive workplace environment. But we didn't do this through stimulating her immune system. I didn't do anything that's going to boost her immune system or push her immune system forward. I didn't even use anything that was specific to the respiratory tract and to help with breathing or to help open her airways. Her body did this all on its own just by supporting the body and removing those obstacles to cure. She had improved energy during the day. She started sleeping through the night without prescription medication, and her digestive symptoms have improved. So she's feeling much, much better than she has been in years. Next, our next principle is tolle causum, and this stands for identifying and treating the cause of illness. And so what I usually will say is that on a very simplistic level, it's understanding why something is happening. And so if I have someone who comes in to see me because their knee hurts all the time, I can give them natural pain relievers, but that doesn't really get to why is the knee hurting. Is the knee hurting because you're sitting funny every day? Is the knee hurting because that joint is breaking down and you have osteoarthritis? Is that knee hurting because you were bitten by an infected tick and it ended up not being treated and now you have chronic Lyme? In order to know why, in order to treat something, you need to understand why it's happening. This can be because of genetic predisposition, it can be because of nutrition and lifestyle practices, it might be environmental practices, it could be social or emotional factors. And so again, goes back to my hour and 15-minute intake. You need to know not just what's going on, but why it's happening. And in order to understand why it's happening, you need to spend time with your patient. So, the patient that I want to focus on to demonstrate tolle causum is JS. JS he came in with his mom, clearly. He didn't bring himself in. And over the course of 12 months, he had several different ear infections. He was constipated from the time he was a newborn infant, and he started to develop eczema in his first month of life, and the eczema had only gotten worse. At this point, is basically covering his body, his cheeks, but also his forehead. I don't have that here. His neck, his trunk, his upper and lower limbs on both sides. He had tried several different things, lots of topical different medications. His mom had taken him to the pediatrician off and on all the time. She mentioned to me that she was placed on antibiotics during pregnancy and she was group B strep positive, so during delivery. But Jay was placed on antibiotics for the first time for an ear infection before he was a month old. He was never able to tolerate breast milk, and so he was started on standard formula. He also wasn't able to tolerate standard formula. At this point, he was on a hypoallergenic formula. He was severely constipated. He only had one very small, hard bowel movement a week, and he had trapped gas. He had a very, very, very difficult time burping. He had almost no flatulence, and he just cried every time that he had a bowel movement. Oftentimes, he passed blood with the bowel movement because the stool was so hard. And so and again, he was given lots of different things by his pediatrician, stool softeners and what have you, Miralax, with minimal efficacy. So with JS, we did some microbiome testing. So we looked at the microbiome in his colon, and we saw elevated levels of bacteria associated with dysbiosis and inflammation, and elevated inflammatory markers, not to the level of IBD, not to the level that you'd see with Crohn's or ulcerative colitis, but higher than you would want to see in a healthy individual. And we also saw evidence of eosinophilia, and eosinophils are associated with allergies. They're associated with mast cells and histamine release, and so we knew that there was some allergic component going on, and we also knew that he had imbalanced bacteria in his gut. Blood test revealed that he had low levels of vitamin D. He was on a formula that had vitamin D included, but he was an African American little boy here in Pennsylvania, and we know that the darker your skin pigment is at this high of a latitude makes it more difficult to absorb vitamin D from the sunshine. And we did some testing with his mom. She also had low levels of vitamin D herself. So our naturopathic treatment included the introduction of a dairy-free infant formula, because we assumed that since he couldn't tolerate breast milk and he couldn't tolerate most formulas, and they were both dairy-based, that maybe he couldn't tolerate dairy. Very, very, very gentle supplementation. I don't love to use natural antimicrobials in a 12-month-old, but this little boy definitely needed them. So some very gentle supplementation to help eliminate that dysbiotic bacteria that was likely causing inflammation along the lining of the gut. We introduced nettle leaf tea because nettle leaf tea helps to stabilize mast cells and minimize the release of histamine. And with that eosinophilia along the gut, we assumed there was some allergic component. Nettle leaves, I would give them to almost anyone. They're very safe. I gave him an infant DHA, which is a type of omega-3, to help to reduce inflammation, because we know he had some inflammation along the lining of his gut, and an infant vitamin D, and recommended getting him outside in the sun to help boost his vitamin D levels naturally, but also sunlight is one of the things that helps improve eczema symptoms. So after 4 weeks, JS no longer had trapped gas. He no longer cried with bowel movements. He had a daily bowel movement. His bowel movements were softer, but his mom said they still weren't perfect. But natural medicine takes some time, and so we're headed in the right direction. The eczema on his trunk and on all of his limbs has resolved. It was still present on his cheeks, and there was one little spot in his forehead. But the eczema on his cheeks was much smaller and less red. He used to scratch all the time. He's no longer scratching at his skin all the time. He hasn't had an ear infection. That doesn't really tell me anything, but I was glad to know. And yeah, naturopathic supportive care is ongoing. So he's doing much, much better. Okay, we're getting there. Okay. And so the next principle of naturopathic medicine is to treat the whole person. And so, for instance, if I have someone who comes in to see me and they have an issue along the digestive tract, I very often I will definitely be talking to them about their mental emotional state, because I talk to everyone about their mental emotional state. But the health of the digestive tract impacts the body and the mind. People are very often anxious or depressed, or they can't sleep. And if I have someone who comes in to see me because they're anxious or depressed or can't sleep, I am definitely going to be talking to them about the health of their gut, because I find out, oh yeah, I've had IBS my whole life, or yes, I'm always constipated, or yes, I go to the bathroom 4 times before I leave for work in the morning. And so we need to look at the health of the whole person, because the health of the nervous system impacts every other organ system. The health of your circulatory system impacts every other organ system. The health of the digestive tract is very important. If you can't digest and absorb your food, what are we even doing? And so we need to talk about the whole body, and I need to get to know each person, because without getting to know you and all of the how your whole body is functioning, I can assess what I need to give you in order to help your body function better. So the patient I'd like to talk about, is JM. JM was a 65-year-old woman who came to see me to treat her dry skin and her acne, at least that's what she called it, and also because she wants to lose weight. For dry skin and acne, she tried everything. I mean, she's 65 and had been dealing with this for a very long time. Lotions, moisturizers, over-the-counter topical medications, prescription topical medications, face washes, cleansers, dietary changes. For weight loss, she's tried every diet out there, intermittent fasting, longer-term fasting, exercise regimens, attempts to identify food sensitivities and remove them. She tried lots and lots and lots of different things. On further questioning, we find out that JM had lifelong constipation. It's not what she came to talk to me about, but whenever she ate, she told me it felt like she had a boulder in her stomach. She had used a variety of natural and over-the-counter medications for bowel support. Nothing really worked. She was taking magnesium all day long, daytime, nighttime. She was taking it around the clock. She was very, very tired, and she also reported some numbness and tingling in her toes. So, on further testing, what we found is that her TSH, her thyroid stimulating hormone, was in the upper limit of the normal range. But it was in the normal range. And most doctors, any doctor that she had had to date, did something called a TSH with reflex T4, meaning that if your TSH is in range, they're not going to test your T4. And so her TSH was, I think, like 4.37-ish. It was up there. It wasn't over 4.5. But we tested her free T4 as well, and we found that even though her TSH was within the normal range, her T4 level was low. It was the higher level of low, but it was low. Her serum vitamin B12 levels were low as well, and we did a SIBO breath test, which tests for small intestinal bacterial overgrowth, and that test was positive. So her diagnosis was what I would call functional hypothyroidism. It wasn't overtly hypothyroid, but she had all of the symptoms of hypothyroidism. She probably had low gastric acid, which could lead to B12 malabsorption and an overgrowth of bacteria in the small intestine. I think again, the state of Pennsylvania doesn't want me to diagnose, but if I looked at the pattern of acne that she had, it was what I would consider rosacea, and rosacea is definitely linked to low gastric acid. So naturopathically, we used natural thyroid hormone replacement because I'm not a prescriber in this state, so I can't even give compounded thyroid medication. So I used a natural supplement, and any supplements I use, I'm very, very cautious about potency and purity and what have you. But we used natural thyroid hormone replacement, a botanical protocol to help to eliminate the overgrowth of bacteria in her small intestine. We gave her a vitamin B12 supplement to help boost her vitamin B12 levels, and a digestive enzyme that included hydrochloric acid and some ox bile to help support digestion in the upper digestive tract, as well as to support pancreatic acid production. So you'll notice we didn't directly address her dry skin, we didn't directly address her acne, and we didn't directly address her weight. After 3 months, the patient's skin was much clearer than it had been in years, even as we transition into the cooler months where it's usually much more dry and irritated. She's having bowel movements about 5 out of the 7 days a week. She's no longer taking magnesium around the clock. Overall, she feels less bloated. She's lost a total of 7 pounds without changing her diet and exercise routine. The numbness in her toes is gone. In fact, she forgot that she had it. She has better overall energy, and of course, naturopathic support is ongoing. It takes some time to heal, especially after several decades when a certain pattern has been ongoing. The next tenet of naturopathic medicine is prevention. So, as naturopathic doctors, and as any doctor is supposed to do,
We regularly assess risk factors and recommend appropriate interventions. So that's mostly working with people to adopt healthy diets and lifestyle choices to help to prevent chronic illness in the future. And so when your primary care doctor says, oh, you're pre-diabetic, watch your diet, think about exercise, we actually work with people to say, okay, this is what it means to watch your diet. This is how we can change your diet. This is the types of exercise you can do, how often you're supposed to do it, what type of exercise might be best. So our goal is to educate and to empower our patients so they don't feel like there's nothing I can do. I just have to wait and I hope diabetes doesn't get me. We empower you so you know these are the things that you can do throughout the course of your day, through when you're home at night, to help to make sure that this doesn't happen in the future. So we become participants with our patient to help us help you move to a place of health. So EJ is a 49-year-old woman who had a diagnosis of stage 3 ERPR negative, HER2 positive breast cancer. And I had worked together with her through her initial surgery, through chemotherapy, through immunotherapy, and through radiation therapy to help to minimize side effects of treatment, to help to support the whole body through conventional treatment, and again, to hopefully augment treatment so that ideally it works better than without my intervention. However, there's no long-term hormonal therapy for just ERPR negative, HER2 positive breast cancer. So while many women will be prescribed tamoxifen or an aromatase inhibitor depending on their menopausal status, there is nothing for EJ to do aside from periodic monitoring from a conventional standpoint. And so she wanted to do whatever she could to avoid a recurrence. And so using evidence-informed research, I advised her on exercise and the types of exercise that have been shown to help to reduce recurrence rates, and on nutrition guidance and using what we know from prospective studies to recommend certain foods that may help to reduce the likelihood of a recurrence in the future. But then I also hyper-personalized her recommendations through what we call genetic SNP testing. SNPs are single nucleotide polymorphisms. They're a one base pair variation, so it's a single nucleotide variation in the genomic code that needs to be present in at least 1% of the population to be called a SNP. These SNPs might have no impact on disease. They may increase a disease risk, or in certain cases decrease a disease risk, and they may alter a person's response to drugs and the environment. So EJ's SNP testing, it was very, very interesting, revealed that she had an impaired detoxification pathway. One of her SNPs, CYP1B1, upregulated her phase 1 detoxification. So detoxification takes part in a two-part process. There's phase 1 detoxification, where you take all of these toxins and you create these intermediary byproducts. The intermediary byproducts are kind of trapped in the body until they go through the phase 2 detoxification pathway. So her phase 1 detoxification pathway was upregulated. So she's taking all of these toxins and very rapidly processing them. But then she had 2 different genetic SNPs that greatly slowed phase 2 detoxification. So she essentially, her body was built so that she would have this huge accumulation of these toxic metabolites with no way to get them out of the body. So that really, we thought, was the crux of what may have been going on. She'd done all of the genetic counseling and didn't have any genes associated with cancer. And so essentially, and she had a slightly increased propensity for inflammation, some alterations in the way that her body methylates. But essentially, what we really wanted to do is really focus on her body's ability to detoxify. And so when you have a diagnosis of breast cancer, there are so many things out there that don't do this, yes, do this. You can do a million different things and have no idea if they're really going to help you. But we knew for EJ that focusing on detoxification, so minimizing her exposure to toxins, and then also supporting phase 2 detoxification so we can get those metabolites out of her body, we're going to really have the most impact on her compared to 12 other women that I could have in the office with a similar diagnosis. And so after 3 years, most importantly, she hasn't had any recurrence to date. CTs, mammograms, and MRIs have all been clear. She does get additional CTC or circulating tumor count testing. It's not as validated with breast cancer, but it's something that she feels really strongly about. And all of those counts have been 0, which is the ideal count if you're looking for circulating tumor cells. And we've optimized her health overall. She's now exercising regularly, eating a diet that's optimal for her specific genes, and just taking a few targeted supplements. I see so many people after a cancer diagnosis that are taking like 20 different supplements. I don't think that's healthy, even though I give supplements on a regular basis. We just want a few that are really going to help your overall health. And she feels healthier than she has in decades, so far so good. She hasn't hit the 5-year mark yet, but she's on her way. And last but not least, the last tenet of naturopathic medicine is docere, or doctor as teacher. And so naturopathic doctors really strive to create a strong doctor-patient relationship and acknowledge this relationship in and of itself as part of what is therapeutic. We empower patients with knowledge and understanding so you can make informed decisions about your health. And so we're really not telling you what to do, but why we think this is a good thing to do. And at first, when I was putting together this presentation, I thought, well, every single case that I've mentioned so far is an example of docere. I don't need to give any other cases. But then I saw this patient on Wednesday, and honestly, I think that I'd like to finish with this story because I have these 5 other cases, and these patients are all doing great. But really, there needs to be humility in medicine as well. And so on Wednesday, I saw a patient, VH, who's a 33-year-old woman who has irregular menstrual periods. More often, they're longer. Her cycles are 35 to 52 days. And we found that they're anovulatory. I worked with her sister who had a similar pattern of menstruation, and with some very basic supplementation and dietary changes, we got her menstrual cycle going regularly. She got pregnant. She's very happy. Her sister came to see me. Well, it's been a year, and VH, her menstrual cycle, she's probably had 2 ovulatory cycles in the past 12 months. Her cycle length, sometimes it's 27 days, sometimes it's 52 days. We've done functional testing. We've done conventional testing. She's had imaging done through her gynecologist. I've talked to colleagues. I've talked to people at the lab. I've gotten advice. We've had probably about 6 visits, and it hasn't improved measurably. To the best of I've tried very, very hard. She's tried very hard. She cried a bit at her last visit. I wanted to cry too. And I was like, I want better for you. I'd hoped for better results than this. And I gave her lots of different options where we could go to from there, including finding another naturopathic doctor, including finding a different type of provider, including this testing, that testing, no testing, taking a break. And she told me at the end, she's like, you know what? I recommend you to everyone because you're the only person who's working with me to try to figure out what's going on. And yeah, I want something better too, but I appreciate your work so much. And that's really all any of us could do. And that's docere. I've done nothing else for her, but she understands what's going on in her body. She understands what should go on in her body. She understands her options. She understands what we're trying and why. And so I've done nothing but docere, but it's been therapeutic for her in some way anyway. And hopefully we'll get her to the place she needs to get. So there are just a few things at the end. I hate naturopathic medicine for every person. There's so much medicine online these days that are like, 20 seconds of a TikTok, everybody needs to do this thing and they're all going to be healthy. You can't get medicine that way. So it's very rare that you can find one thing that works for every person. And I'm also preaching to the choir here, I understand, but there are things that I recommend to almost every person. The first is breathing. Breathing deep, breathing into your abdomen, engaging your diaphragm, supporting a balance of sympathetic and parasympathetic nervous system function. This helps us get through everyday life, where every single day is a stress event, where we're all holding a phone and know the news at a moment's notice. So I always am working with my patients to help them to adopt a breathing practice. And with breathing too, honestly, I think air filters, a good high quality air filter in your bedroom, it's also really, really important to help to remove the particulate matter from the air. Ideally, you're spending 7 to 9 hours of uninterrupted time in your bedroom breathing deeply. Make sure that the air you're breathing in there is healthy air. Move. Humans are healthiest when we move, and again, I'm preaching to the choir here at a Yoga Research Society, but so many people today have sedentary lifestyles. We've been forced into it because of our jobs. And so I work with everyone to incorporate physical activity into your day-to-day life. And ideally, exercise should be cardiovascular for your heart and your blood vessels, but also some resistance exercise to build lean muscle mass, because you'll be more metabolically healthy if you have more lean muscle mass. Adopt a whole foods diet. There's this idea in modern society that an extreme diet is going to give you an extreme result. That is not the case, and that has never been proven in studies. And so I recommend a whole foods-based diet where the foundation of your diet are vegetables and fruit with the addition of some lean protein. And a lot of people forget to think about fats, but fats are actually really important. I spend a lot of time talking to people so that they know the difference between saturated fat, which you want to avoid in large quantities, and mono and polyunsaturated fat, which is going to help to reduce inflammation, help to support your central nervous system, help to support your cardiovascular system. And I do recommend trying to eat seasonally, so you get a natural rotation diet, and you're not eating the same foods day in, day out, month in, month out, but you're eating with the season, and so you get this natural rotation that I think is much healthier. Sleep. And so I tell people all the time that we have to sleep. These days, very often, people don't sleep. They're up really late, they're awake the first thing in the morning. You need to prioritize sleep, and I recommend 7 to 9 hours of sleep every night, and to keep your room as dark as possible, especially if you're living here in the city, because your body is going to make more melatonin the darker your room is. And so blackout blinds, blackout curtains, and then of course avoiding screens for at least half an hour before you go to sleep. I talk with people all the time about sleep hygiene practices and the need for us as adults to be our own parents, to create these rituals before bed that are going to let us know that we're loved, that we're cared for, that we're safe and comfortable, so that we can fall asleep and sleep soundly through the night. And then I do regularly recommend herbal teas. These are some of my favorites that are very safe, and anyone I think can incorporate them in their day-to-day life. But I love working with tea whenever I can, so it's not another pill or capsule for you to take. And you can use something that you drink on a regular basis, and it is your medicine. So when I'm in the office at work, I have a variety of teas, and these are my medicines that I can drink as I eat and as I work and as I see patients. So yeah, those are some of the things that every person can use and be a bit more naturopathic. All right, and that is everything. So does anyone have any questions?
Yes, from the Zoom. This is back to the landscaper, your KS, and Vicki says, you mentioned KS was a landscaper. Were you able to create an understanding of a potential connection between the occupational exposures to pesticides and his disease?
So long-term, I think that that could be something that we can do. At that time, it's so difficult because cancer is really a very complicated process, and usually the inciting factor often happens 1 or 2 decades before the diagnosis, because it's this 4-step process of carcinogenesis that is very slow. But then when it's there, it's suddenly like, whoa, it goes very quick. At that point in time, it wouldn't serve anything to figure out the cause. KS needed to keep his job, to keep his insurance, and to keep his family in their home. Long-term, KS very well may need to find a different occupation. And when we're done with active treatment, we can go back and see, is there any toxic burden? Is there anything that we can do to help ensure that his, he is disease-free for as long as possible? But in that moment in time, it wouldn't have served us to figure that out. It wouldn't have served him. He needed treatment as soon as he could get it. He had already delayed treatment for 3 months, and he had had repeat scans that showed that all of his lesions were growing, and I wanted him to live, essentially. And so long-term, that's a very good question, but we're not at that place yet.
Do you have experience in treating dermatologic damage, sun damage, basal cell, squamous cell, and the like?
I do. I do recommend whenever a person is a candidate for surgery, so basal cell, squamous cell, they're going to recommend an excision. I support that excision, but I'd like to prevent it happening again, so I can help a person through surgery to give them everything that the body needs for that wound to heal, and then we can talk about prevention in the future. I love preventing skin cancer or precancerous lesions. That's a favorite of mine. So, yeah.
One of your patients, you highlighted that you were going to minimize their environmental toxin exposure. How do you go about doing that?
Sure, there's so many different ways. Oh, I don't think people heard. Yes, so she said in one of the cases I talked about minimizing toxic exposure and how would I go about doing that. There's so many different ways, and I could probably talk for an hour and a half about that. But, everything from avoiding plastics, especially plastics when it's associated with cooking and food storage, getting rid of pots and pans that had cracked ceramic enamel, investing in either, investing in new pots and pans, investing in new food storage ideas, avoiding plastic water bottles, getting good air filters in the rooms of the house where you spend the most time, eating organic whenever possible, paying attention to the Dirty Dozen and the Clean 15 in the environmental working group, gradually over time replacing your house cleaners and your health and beauty aids with non-toxic forms of those supplements. So those are some of the best ways to do it. And I know that's like a mouthful, but we do that over time.
Thank you. Thank you. I had a woman recommend to me to take a bath of a pound of Epsom salt and a pound of baking soda to get rid of the G5 and G4 and G3 things in the air. Do you have any experience with that, or what the prevailing theory is, or is that just way out there, science?
I think that's a little out there. I don't think it's harmful in any way. I regularly recommend Epsom salt baths. I think they're really lovely, and I use them for a number of reasons. But that's probably not something that's not a treatment that I would use. Okay, thank you. Yeah.
Is there any place within this whole structure for therapies involving touch? I've noticed like massage or Feldenkrais or Rolfing or shiatsu or any of them. I've noticed in my own life the great healing power of touch for me, and I'm also in the business too, so.
Sure, sure. Yes, absolutely. And I'd say that my practice has evolved for 19 years here in Pennsylvania. And for most of those, I wasn't a licensed medical provider. I couldn't be in the state, so it takes away my ability to touch. And so a lot of what I do is evolved outside of that area, but in our education, we do learn the basics of massage. Through school, a lot of naturopathic doctors end up becoming licensed massage therapists. I took electives in craniosacral 1 and 2. I still do that on my daughter when she gets a sprained ankle when she's a dancer. And so I think touch is amazing. Oh, and we learn high velocity manipulation. That's not why I went to school. And here, I don't want to step on any chiropractor's toes, and so that's also touch. So we learn a lot of touch, and Dr. Bastier was a chiropractor by trade.
I'm just very impressed by that because it would seem that it would add a great deal of dimension to the way in which you see.
Yeah, yeah.
So, happy to do that.
I have a question about the woman, the 65-year-old woman with the skin issues and the gastric symptoms, right? And what do you think is the connection between that and the sensation in the toes, right?
The B12
Because that would
deficiency.
appear to be nerve, but
It was vitamin B12 deficiency. Yeah.
it was what?
Vitamin B12
Oh,
deficiency.
B12, got it.
Yeah.
Okay.
B12 is very difficult to absorb, and you need a lot of gastric acid for that to happen. And so I think that that's what was getting in the way of her ability to absorb B12. I think that was likely one of the reasons why she was as tired as she was, along with the functional hypothyroidism. But the numbness and tingling in her toes and the rosacea, and I was like, oh, this is a gastric acid thing.
How would you distinguish the difference between your practice and a functional medicine practice?
So I was there when functional medicine was born. There's an LCD Sound System song that says, I was there. I was there. I was there when Andrew Weil came to Bastyr University to learn more about naturopathic medicine and then took that information back to the University of Arizona. And so functional medicine is essentially a combination of the conventional medical model and naturopathic medicine. I would say one of the biggest differences is that we have these tenets that underpin our 4 to 5 years of medical training, whereas medical doctors that engage in functional medicine, they have that conventional medicine model that they tack these more integrative ideas onto. I would say for a patient, functional medicine visits tend to be a little bit shorter. Functional medicine doctors tend to charge more money, and functional medicine doctors often recommend a lot more testing and a lot more supplements. So those are the main differences.
Yes, hi, just wondering, is any insurance companies, anything, so it's all out of pocket?
It is out of pocket. I will say that for people that have health savings accounts, you can use health saving account money for that's associated with your insurance for a naturopathic visit. Not everybody does, though. For me specifically, I am very, very, very invested in the idea that everyone should have access to naturopathic medicine. So I do my best to keep my cost as low as possible. And that's something that luckily here in Philadelphia, rent isn't as high. I work in the Bach building where rents are especially low. And so I work with people where they're at to try to get this medicine to people, because traditional naturopathic medicine was not medicine for the rich. It was medicine that Knipe gave to his parishioners. Dr. Bastier, he worked with people during the Depression and charged like 50 cents for a visit. So it's really medicine that should be for everyone, and that's something that I try to make available to everyone.
Do you still recommend cold water baths for anything?
Yeah, no, I mostly, not plain cold water, not usually, but more often than not, contrast hydrotherapy. So alternating between hot and cold. And I can do that either constitutionally for the whole body or on specific parts of the body. So especially for musculoskeletal complaints, alternating hot and cold creates a pump. And so it's going to dilate blood vessels and then contract them, dilate them and contract them. So we move waste products out and we move blood into the area, and it helps speed up healing faster.
Is that like 20 minutes heat, 20 minutes cold?
No, usually I do it much quicker. So oftentimes it's about 3 minutes hot, 30 seconds cold.
How do you perform your panel of tests that you were speaking about, where you found that they were fungus or mold-based problems?
Yeah, so I use, I mean, it's my job to know which labs to use. And so I only use, companies that do validated testing, blah, 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 blah. I meet all the requirements. The mold test, mycotoxins, you test through urine. And so I work with a company called Mosaic Diagnostics. We do that's where I do my mycotoxin testing. For a long time, it was very difficult for me to order lab tests, again, because of regulations in the state. And I would often have to work through the circuitous pathway. But now I just work through a company called Rupa Health. Because insurance doesn't cover me, they don't cover tests that I order. But Rupa works with me to get you lab testing for a few dollars. So oftentimes it's definitely not as expensive as if we tried to order directly through Quest or LabCorp and they bounced it to your insurance and insurance sent it back. So, CBC and CMP, we're talking about less than $10. So it depends. I don't know if that answers your question. Yeah. Thank you. You're welcome. Thank you. Thank you, everybody.